office recommended communicate with doctor and oxygen provider and educate the oxygen provider. And how does a person with pulmonary fibrosis differ from someone with, say, COPD? Pulmonary fibrosis is what they call a restricted disease, whereas COPD is obstructive. So we won't go into that much further, but then say that. And normally, pulmonary fibrosis patients will require more oxygen for exertion than for sitting. And that seems to be true for all our patients. Pulmonary fibrosis patient will progress to higher levels of oxygen requirements and more emphasis on adequate saturation and less concern for CO2 levels is what pulmonary fibrosis patients have versus the COPD patients. Okay, the types of oxygen equipment, and we said some briefly think there's the stationary, portable, travel ones, and 3 delivery forms, the concentrated, the gas, and the liquids. And you want to take it from here and just talk about each of those?
Yeah, this would be considered a stationary. This is a stationary oxygen. This is an oxygen concentrator. Liquid oxygen has a stationary as well, which is a big drum type setup where people can fill off of that reservoir. That's another stationary. Portables are liquid oxygen portables, portable oxygen concentrators, and tanks of all different sizes. You've seen these cylinders. I see a lot of you have them. They come in all different sizes. These are portables.
Okay, any questions about any of those? Or
when you say all different sizes, is that the smallest or the largest?
This is the smallest. Yeah. This is the smallest of this type of a system. They have some that are shorter. Our company has decided to stop at this because of leader flows and things.
For you guys.
Yeah.
That's a little bit
Fatter around. So they go fatter and then they go longer.
That's a slightly larger contents-wise than this one.
Right. So the smaller you go, the less time you get out of your tank. We stop here. Other providers out there have maybe shorter ones, but again, you've got to manage your time. You may only get a short amount of time out of those little squatty ones. There's some little ones out there that only last for maybe 45 minutes.
So at 2 liters a minute, how much does that give you?
This one here is a pulsing system. This will last about 5 hours. So kind of nice. And it can go in a backpack. I saw Lee had that in a backpack type deal where you can put it over both shoulders to disperse the weight. Others I saw had a kind of a shoulder carrying case like a purse. Either way. So pretty light. These ones, this liquid system and this one here are about the same weight. So someone had a question?
Those smaller ones, they come in like for 5 liters continuous?
This one here, you mean non-pulse flow? We have them in E tanks and D tanks, which is the next size down that can go in a shoulder pack.
E is the size you've got.
E is the size you have in the cart. Those go in continuous flow. But they can be used with this filling system that you can fill in your home.
Like how about when you're traveling? Can you have a small one like that?
If you can tolerate a conserving device. So let me talk a little bit about conserving devices. Conserving devices, like you mentioned, you have your regulator that gives you your continuous flow, and then a conserving device will give you a pulse dose of oxygen. Every time you take a breath, it gives you a bolus of oxygen. So if you can trigger a conserving device, it definitely makes life a lot easier because you can go smaller and smaller with your tanks, your portables. So portability is a lot easier. We have some conservers out there It's called a smart dose conserver that'll actually titrate your oxygen levels plus or minus a liter here or there. So if a doctor gives you a range liter flow, say between 2 and 4 liters, it will go up or down and give you, it'll oxygenate you as you go. And it factors in your respirations, so how fast you're breathing. So if you go up in your respiration, it will bump up a level and oxygenate you.
We found that some patients will not saturate well during exertion, fine during relaxing, sitting down, but as soon as they start to exert, their oxygen needs rise quite a bit. So this device that Pete referred to actually doubles the liter flow when a patient exerts. The downside is it's going to use your oxygen more quickly.
Faster, right?
So no one wants to use up their oxygen, so they deprive themselves of oxygen. So it's a kind of a bad trade-off. And we realize as well as anybody that none of this is completely convenient.